It might be quite simple to overlook the early warning signs of colon cancer since most people avoid seeing a doctor. Thousands of individuals are in danger since colon cancer symptoms often go unnoticed without medical tests. And it is not as if most people choose to ignore the signs and symptoms of colon cancer. Many of them are often undetected, and others may be readily ascribed to other conditions. For instance, the symptoms of a colon tumor may be like those of hemorrhoids, ulcerative colitis, ulcers, or Crohn's disease. As a person progresses through the stages of colon cancer, the onset of symptoms is often too late. Colorectal cancer has a sluggish growth rate, and symptoms of a tumor in the colon may not manifest until they are quite large. They will eventually pierce the intestinal wall and may cause bleeding. Occasionally, this bleeding is not visible to the naked eye and can only be detected with microscopic fecal matter testing. When cancer spreads, it often does so through lymph nodes, but it may also metastasize to distant organs such as the liver, brain, and lungs. In the United States, colorectal cancer is the third leading cause of cancer-related deaths among both men and women, and the second highest cause of cancer-related deaths overall. In 2022, it is estimated to cause around 52,580 fatalities. Today, we are going to give you some early warning signs of colon cancer you should not ignore. Before we get into it, please remember to like and subscribe for more. Bowel changes. It is common to have periodic bowel problems. Everyone experiences a spell of diarrhea or constipation from time to time. Having occasional bowel problems is completely normal. However, if you have seen consistent changes in the regularity of your bowel movements, this might be an indication that you have colon cancer. Cancer of the colon affects the whole colon, while cancer of the rectal region only affects the bottom portion of the colon. Lower colon cancer symptoms include regular diarrhea, constipation, and incontinence. If you are unable to go to the toilet or discover that you are going suddenly, it is possible that it is a sign of colon cancer. Blood. If you notice blood in the toilet bowl or on the toilet paper after wiping, it could be an early sign of colon cancer. However, this symptom is also a common symptom of conditions such as Crohn's disease, hemorrhoids, ulcers, or ulcerative colitis. It is possible that you have colon cancer if you have rectal bleeding in general, not only in your stool. If you notice blood stains on your underwear, it could be an early sign of a tumor in the colon. Bleeding tumors typically mean that they have grown, which paves the way for other symptoms to develop. Cancer screenings on a regular basis are essential. It is vital to see your primary care physician at least once each year, or more often if they urge it, for the purpose of early diagnosis and increased treatment efficacy. Unexplained weight loss. Unintentional weight loss is often the initial sign of a variety of diseases. It is also rather prevalent among colon cancer patients. Approximately 40% of cancer patients exhibit this symptom. The worst aspect is that there is a potential that patients may develop cachexia. This is a weight loss complication accompanied by muscle mass loss. It may also exacerbate other cancer-related symptoms, making them more acute. However, weight fluctuations are not necessarily indicative of significant diseases. Even the majority of instances are unrelated to colon cancer. Again, it is associated with several disorders. There are many ways in which cancer may cause a change in weight. Even the environment in which it develops may have an influence. Some specialists think that malignant cells may use the majority of the body's energy supply. They may also alter the body's metabolism or energy production from diet. Another intriguing aspect is that cancer often affects a patient's appetite, and those who lack an appetite tend to consume less food than normal, resulting in weight reduction. Anemia. Anemia is simply described as either a deficiency in red blood cells that carry oxygen to bodily tissues or a deficiency in hemoglobin, a protein required by red blood cells to transport oxygen. Anemia is often undiagnosed. If symptoms manifest, they are often mild. In certain instances, a person may experience fatigue or lethargy. Others may have trouble focusing or shortness of breath after moderately hard exercise or physical activities. Although anemia is strongly associated with cancer, its origin might vary depending on the kind of malignancy. Certain kinds of cancer, such as bone marrow cancer, have a direct influence on the body's capacity to create red blood cells, resulting in severe anemia. With colon cancer, the process is specific. When the colon is affected, the most common cause of anemia is thought to be bleeding. This is because the tumor secretes substances that encourage the development of new blood vessels. As the tumor expands, the blood vessels rupture, resulting in the loss of red blood cells. In turn, the bleeding might result in an iron deficit. Even if there are sufficient iron levels in the blood, the inflammation in the surrounding area might cause iron molecules to get stuck in immune cells. As the inflammation continues, the availability of iron decreases, causing iron deficiency anemia to develop. Fatigue. Cancer fatigue is different from regular fatigue, like the type of exhaustion you feel at the end of a long day or when you have not had enough sleep. Cancer fatigue may last for days or even weeks. Cancer fatigue may cause a person to feel exhausted even after getting a good night's rest. And willpower or coffee are not effective ways to overcome this feeling of exhaustion. The following fatigue symptoms may be an early indicator of colon cancer. A profound feeling of fatigue that is often referred to as full body fatigue. This type of fatigue cannot be alleviated by sleep or rest. Experiencing fatigue with even the most routine of tasks, such as going to the mailbox, having trouble concentrating on tasks, feeling more emotional than you normally would, feeling the onset of weariness more quickly than usual, less desire to engage in things you typically like, constant abdominal pain. Pain from colon cancer is often experienced as cramping or niggling in the abdominal region. The specific location of the discomfort might change depending on the region of the colon that is affected, the size of the tumor, and the degree to which it is migrated to other parts of the body, which is referred to as metastasis. For instance, if cancer has advanced to the liver, symptoms such as discomfort in the upper right abdomen may be experienced. It is not always easy to determine whether pain has been caused by the colon. The colon is positioned in the abdomen and travels from the left side of the abdomen all the way up to the right side, then back down to the left side. Because of this, discomfort in the colon may spread to other areas of the stomach and create pain elsewhere. This component of the digestive system is responsible for absorbing water and a few nutrients from the food that is consumed. Food is moved through the colon by the contraction of the muscles of that organ. You could have discomfort in the colon if there is irritation, inflammation, or a blockage in the area. You may also have discomfort and other symptoms if there is an inadequate supply of blood to a portion or the whole of the colon. Prevention is better than cure, as the old saying goes. What can you do to prevent this debilitating and lethal disease? If cancer runs in your family, or if you have a disease that increases your chance of developing a specific form of cancer, it is necessary to be conscious of your risk factors. Being proactive and adopting good life choices may help reduce the chance of cancer. Among the steps you may take are: regular, moderate exercise reduces the chance of developing cancer by at least 30%, according to scientific research. Aim for 30 minutes daily. Maintaining a healthy, balanced diet. This includes a low-sugar, high-fiber diet with little or no red meat and plenty of fresh fruits and vegetables. You may consume fats, but only those that are healthful, such as olive oil. If you smoke cigarettes, your chance of developing cancer is 15 to 30 times higher than those who do not. Quit now! Restricting alcohol intake. 1 drink per day has been demonstrated to lower the risk of heart disease among other health problems. However, excessive alcohol use may raise the risk of other malignancies. The combination of smoking and heavy drinking has been shown to raise the risk of mouth cancer, esophageal cancer, and colon cancer. Get some sun. As studies suggest that high blood levels of vitamin D may be associated with a decreased risk of colon cancer. Researchers concluded, after analyzing data on 5,706 people with colorectal cancer and 7,107 healthy adults, that women with the highest levels of vitamin D had a statistically significant lower risk of colon cancer than those with the lowest levels. The risk was lowered for males, although not statistically significantly. Folate. A B vitamin found in foods such as spinach, asparagus, and fortified cereals may reduce the risk of colon cancer, according to a systematic review and meta-analysis published in 2015. Nonetheless, the evidence is inconclusive and further investigation is required. The recommended daily allowance of folate for most individuals is 400 micrograms. In cell culture experiments conducted in the laboratory, scientists have shown that quercetin, an antioxidant present in tea, may inhibit the development of colon cancer. Moreover, 2012 population-based research of 2,664 adults indicated that dietary quercetin may be associated with a lower risk of proximal colon cancer. This association was not detected for colon cancer in the distal colon, nor was it shown in those with high tea consumption. Quercetin is available as a dietary supplement and occurs naturally in foods such as apples, onions, and berries. It is of the utmost importance to have an early diagnosis of colon cancer to enhance treatment, and achieving an early diagnosis begins with following regular screening guidelines and understanding your family history. Clinical recommendations indicate that average risk individuals begin colon cancer screening at age 45. For those with a family history or other risk factors, screening should start sooner. Test yourself now. Do not procrastinate. Watch these videos for more. Please like and subscribe, and thanks for watching.